I'd like to take this time, dear Lord, to thank you for giving us this opportunity to be here tonight to help our fellow man. I want to thank you for everything you've done for us and the people of Greene County. At times we're impatient. We ask that you put up with us and our feelings just a little bit longer until we get to meet you in person. We ask all this in your Son Jesus Christ's name. Amen.
Amen.
Okay. This is Tuesday the 16th, Greene County General Hospital Public Board Meeting. I will at this time call the meeting to order. And I ask that the motion to waive the reading of the minutes and approve minutes of the meeting dated May 19th as presented. Do I have such a motion?
So moved.
I have a motion by Nate. Do I have a second? Nancy? All those in favor, aye?
Aye.
Any nays? Thank you. Consent item, patient safety environment. Motion to approve the patient safety plan. We have a motion to approve the plan.
So moved.
Tim makes a motion. Do I have a second? Matt seconds. All those in favor?
Aye.
Any nays? Motion passes. Another consent item, emergency operation plan. Do I have such a motion?
Motion.
I'll second.
Ed's a motion. Do I have a second? Cheryl. I have a second for Cheryl. All those in favor, aye?
Aye.
Any nays? Motion passes. Medical equipment management is another consent item. Do I have a motion for that?
I'll make the motion.
Jerry makes a motion. I have a second.
Second.
Second by Tim. All those in favor, aye?
Aye.
Any nays? Motion passes. If you have any questions as we go through here, feel free to jump up and ask or say something. If not, we'll just keep on going. Utility management plan. We have need a motion to approve the utility management plan as recommended.
So moved.
Nate makes a motion. Do I have a second?
Second.
Second for Cheryl. All those in favor, aye?
Aye.
Any nays? Motion passes. Water safety plan. We need a motion to approve the water safety plan as recommended. Do I have such a motion? Nancy makes a motion. Do I have a second? Harry makes a second. All those in favor, aye?
Aye.
Any nays? Motion passes. Let's go to ultrasound equipment. We're making a motion to approve the purchase of ultrasound, and we've at this time we've corrected there to just one at $115,000. I need a motion to make that purchase.
I'll make that motion.
Nate makes a motion. Dr. Power seconds. All those in favor?
Aye.
Any nays? Motion passes. The police revenue cycle contract. Motion to approve the contracting with Coral Health Integrity Plus program for revenue cycle support. Need such a motion.
I'll make the motion.
Jimmy makes a motion. Do I have a second?
Second.
Second by Tim. All those in favor, aye?
Aye.
Aye. Motion passes. The police department operating plan, and this was a motion to approve the updated police department plan, and that had to do, if I am correct, with tasering. Is that right, Barb? Okay. Need such a motion to pass? Harry makes the motion. Do I have a second?
Second.
Second by Nate. All those in favor, aye?
Aye.
Any nays? Motion passes. Schedule of upcoming consent items. In July will be a human resource management plan. You can look at that. Brenda, do you want to mention anything on that or add to it?
No.
Okay, that'll be coming up in July. Schedule of upcoming capital purchases. There's a list below on your package: emergency power, EMT, med gas. Take a look at those. Those will be for your information to purchase coming up in the future. Approval is needed because they're greater than $50,000. You want to keep in mind that Brenda, the CEO, has authority to go up to $50,000. Okay. Review review the write-offs. Rebecca, what do we got on write-offs?
They're actually a little bit less this time. I feel like we are probably doing a better job reviewing these, but getting these to our collection agency. I think our new collection agency is kind of, is taking a kind of a firm approach with making some of those older accounts, like, they make the phone calls, they contact them, and they don't really have a time limit like we had with the other one. The other thing, Jesse and I have already been in conversation about different things that have, just essentially in the past, you know, we've always written it off, you know what I mean? Which I think she's gonna take a new look at it and say, but why? So I think we're gonna have maybe a different approach just with the upfront, you know, why are you writing this off? What if we did this instead? We could at least collect some of the money instead of just, you know, doing a straight write-off. So, she's already kind of come up with some ideas as to how to approach that and how to talk to some of the billers and some of the people they're doing the write-offs. It is lower, like the hospital this month, I think was in the $800,000 range. We're usually anywhere up to $1 million or even more than $1 million in a month. And the other two, the clinics and the specialty, were pretty much average or below average where they usually are, and they're much lower, tens of thousands instead of hundreds of thousands. So I feel like they're both heading in the right direction. We wanna keep in mind the ones that we can control. We wanna be able to control those. So I think maybe with the help of the lady from HCM, who's gonna be kind of helping with our billers, and with Jesse kind of working in tandem, I think it's gonna come out a little better each month. I feel like it's headed in the right direction.
Any questions for Rebecca? Anything else, Rebecca, that you want to add, or, okay? At this time, I ask for a motion to approve the write-offs.
So moved.
Nate makes the motion, to have a second. Matt makes a second, all those favor, aye?
Aye.
Any nays? Write-offs are approved. Admin report, voice of the patient, Brenda?
Yeah, so typically I review patient comments, but today I'm gonna let you actually hear from a patient. So this is a patient, Miss Raquel, that traveled here from Canada for Dr. Parmenter to do her surgery. And so she, while she was here, wanted to record a testimony. We've been recording testimonies from some of our patients, and we'll be sharing these. This will actually be shared. You'll see it in a shortened version of this on Channel WTWO coming up, but I wanted you all to see this first. So here you go. I hope you can hear it. Can you hear it?
Hello, my name is Raquel Benich. I have had 4 operations on my left foot that were not necessary in Canada. And my sister and my brother pushed me to this so that I could have a second opinion and see if something could be done to make me more functional. Finally, my brother said enough of this. He spoke to Dr. Parmenter, and Dr. Parmenter moved the whole world and to get the best treatment and the best materials. And finally, I said, okay, I'm not waiting, I'm coming. And so I arrived here. First of all, I have much respect for Dr. Parmenter. I saw a couple of surgeons in Canada and said, nothing we can do. And he said, I can reconstruct your feet. So I had full faith in him. So I wasn't even afraid. I never forget this place. The team, totally amazing. They work with genuine care, kindness, empathy, everything.
That's very good.
She lives for that, doesn't she?
Yeah.
Yeah, do it for free.
He loves that.
Yeah.
So that's our voice of the patient tonight.
And you know, really, that is great. She comes all the way from Canada, okay? Where we have people that think they have to drive 45, 50 minutes to get what she comes all the way from Canada to get right here. So, I think that's good. Anything else, Brenda?
Nope, that's all.
Okay. Any questions, comments? Okay. May financial, let's go back to Rebecca.
We had 3 payrolls in May, and if you can tell, they're going down. So it started with 1.2 and it got down to 1.14 by the end of the month. And we're hoping it stays that low, and if not, we ramp up and we get grant money to pay for the ramp up. The regular claims, there was about $2.1 million, which is a little less. We are in the process of trying to change our AP system and it's our AP inventory. It's a lot of the systems to this multi-view. So there has been kind of a lull in trying to get some things out of the old system, like paid down, and get the new one up and running. Today was the first day I was able to actually get payments to run through our banking online like it was supposed to from the new system. So there's been a little bit of a lull. We are now in it and making the new system kind of work for us. For the month, we did have a loss, but I want to say our auditors, along the process of our audit, there were some things that happened in 26 that they said, really, you probably should have recorded that in 25. So things that we had recorded in 26, they made us go back and put the revenue part of it back in 25 because of the year it associated with. Specifically, the big one was that state fiscal year dish funding, the 23 HSL, $2.2 million. They said it was state fiscal year 23, you really should put it back into a previous period. So that's a big portion of what happened this month, is there were some entries like that happened that we had to put back into 25 for the audit. I think all in all, cash-wise, we're kind of holding steady. I feel like maybe with some changes, some tweaks to the revenue cycle and some things that are I feel like we're heading in the right direction, plus with all the funding that Brenda's been working really hard to get in our door. I think we're gonna be prepared for the future, and I think the future is gonna be really bright for this hospital.
Questions? Comments? How about, Tim, are you usually asked about prior approvals? Did we have it?
We had timely filing. There was less than $10,000 in there for this month.
Okay.
But most of that, I think, was stuff that Shauna was trying to work at from old stuff that she was trying to get rid of off the 23, I think, 2023 and 2024, stuff that we were never gonna be able to collect.
And then those
So-
filing limits are,
And I feel like the filing limits are pretty short on those. I mean, you have 90 days. If you don't file something within 90 days, you're done.
Mhm.
Not all of them, Medicare's not that way, but a lot of like your main insurances.
So how long does it take to get rid of all this old stuff? Because we've been talking about that for quite some time.
Since I've been on the
Yeah.
board.
well, I've been on the board 14 years and we've been working on it ever since I've been on.
Yeah. So our old collection agency, we thought we had a very good knowledge of what they had on their books. We did not. They came up with, was it 1,200 new accounts, or accounts that we thought were, that we did not have listed. Basically, we had already thought we had gotten rid of and they were cleaned up. And the old company came back to us with 1,200 additional accounts that they still had on their books. So things like that happen.
Right.
And it's like you're always fighting an uphill battle, trying to take care of the things that are older that you just need to be cleared out.
The switching that collections agency was part of that
Was
strategy
crucial.
of just getting rid of that forever.
Right.
Okay.
Right.
Okay, any further questions for Rebecca? If not, I'd ask for a motion to approve the financials as presented. Nancy, make a
Second.
motion. Tim, the second. All those in favor, aye?
Aye.
Any nays? Financials approved. Credentialing report. Dr. Peter, Dr. Mike, do you have anything on that?
Credentials were reviewed and approved by the medical staff, recommended for approval by the board.
Okay. Look down through there, anyone have any question on credentialing?
I'd make a motion to approve the credentialing report.
Have a motion approved, do I have a second?
I'll second.
Jimmy seconds, all those in favor?
Aye.
Any nays? Motion is approved. Building and Grounds Committee report, Rick or Jason?
I don't have anything, Jason probably does. Well, our last grounds committee meeting, we talked about the McDonald House, and you had recommended another quote, and that turned out to be worthy effort. So that's who we went with. That was supposed to start possibly today. Didn't look like they'd started today, so I anticipate that starting tomorrow.
Okay.
And we have done some cleanup on that corner, removed all the signage.
Looks a lot better.
It
Looks
does
great.
look a lot
I
cleaner.
like having you as a neighbor.
Yeah, other than that trip to Arthrex was fantastic.
Good. Good. Okay. Finance and Planning Committee, Rebecca,
We did not meet.
meeting governance nominating, Jimmy,
Nothing to report.
Green County General Hospital Foundation report, Brenda,
Nothing to report.
how about the medical staff report? One of the doctors have anything?
I wasn't there.
You wasn't
No, I
there.
got that.
My God, did
You
we
missed a
pay
good
you?
one, Dr. Fowler.
We did meet last week and had a normal, evening meeting. Educational topics were the resurgence of Ebola in Africa and the monitoring that's going on with travelers in the United States. And, interestingly, New World Screwworm, which is, at the time we prepared the presentation, there had been one case moved from Mexico into the US, but now there's several other cases, so. The Department of Agriculture is really the lead on that. It doesn't usually affect humans that often, but it is an interesting, zoonotic disease, and it's probably gonna gain a lot of attention in the United States.
I think we eradicated that back in the sixties, did we not?
We did, didn't eradicate it, but they pushed it, from the southern United States with sterile male flies that get radiated, sterilizes them, and they pushed it all the way down basically to Panama. And then somehow it jumped recently back up to Mexico. So, they're gonna rejuvenate the factories that produce sterile male flies and try to push it back.
Okay.
But can you talk about this Indiana state entomologist and the connection there? Because I think that's interesting.
Well, the entomologist for the Indiana State Department of Health is one of the people who can identify the larvae, the maggots,
Right.
readily. And he said a lot of the younger people don't have any experience, they've never seen it. So a lot of the samples go there for identification, even the Board of Animal Health sends in their stuff. It's really been, he's really interested in it. It's basically is a fly disease, but the difference is this fly, the maggots feed on living tissue instead of dead tissue. So most maggots are in tissue that's dead, and this one feeds on living tissue. So it invades a wound, then the maggots can go in deep into the wound, and then so like cattle can be eaten from the inside in about 10 days and they die.
Right.
So it's devastating to cattle herds, but it's the only disease that's really like this. It's the only fly that's like this.
Were there a couple cases in Texas already?
Yeah, there's been several cases now. Yeah, even in, I can't remember which state, another southwest state had, so there's actually a lot of restrictions on importing animals, traveling between states. There's gonna be, examinations, certifications. They really don't want this in the rest of the
Of course,
country.
the one thing that I'm sure they keep in mind, but most people wouldn't, is it's in the wildlife too.
Right, yeah.
Deer, whatever that's moving all the time.
The flies are there, so yeah, they don't want that to be imported. But there was a case in New Jersey that was imported, at some point recently, and they did not dispose of the maggots in a proper way and caused a lot of stir. They had to get the stuff out of the landfill and try to make sure no flies came from it.
Yeah.
They really are scared this is just gonna become an outbreak, and it'd be devastating to livestock.
Yeah. I tell you, I think a good thing to bring up at one of your medical staff meetings, which I'm hearing more and more about, is tick bites and alpha-gal, that type of disease. I would like to have a presentation personally myself in here sometime.
We
Okay.
had a discussion on it at a provider meeting, just about how to, you know, the lab results and how they come back from LabCorp, cause they're a little challenging sometimes to interpret, and so we have had educational presentation for all of our primary care providers on that.
Yeah.
This is tick season, so for our provider meeting tomorrow, actually, I have, a slide deck on tick-borne diseases and prevention, so. So alpha-gal is just the one, that you become allergic to red meat.
Right.
And we're diagnosing that, we actually have some employees and employee family members, and we have patients that we've now diagnosed to have alpha-gal, so it is definitely here. You don't want to be bitten by ticks. Tick prevention is really important. Rocky Mountain spotted fever can kill you, but you can't eat red meat if you get this disease, so.
Then you might as well be dead.
Somebody just get that.
Okay, well, thank you, Doctor. Where we at? Maybe it's new business, old business,
They got a cure.
any old business or new business anybody wants to bring up?
Sure is.
Any public comments, anybody out in the public here?
Nope.
No?
Not that I'm aware of.
Okay. That's not being the case, I look for a motion of affirmation, executive session, the board of trustees met prior to the regular meeting, in which no item discussed other than those in the agenda, no action taken. Do I have such a motion?
Motion.
Terry? Tim, second, all those in favor?
Aye.
Any nays? Motion passes at this time.